Hey, but we're going to be jumping into some great conversation, especially for the gents out there and for everybody that needs to get educated on this one. And no longer shall we feel embarrassed. Let's be proud to talk about it. Now, November is Movember, and it's a month dedicated to men's health and especially to the cancers and conditions that men often avoid talking about. Now, one of the biggest of these is prostate health, which is a topic still wrapped in silence, stigma, and late diagnosis. Now, many men only seek help when symptoms become severe, even though early detection can dramatically improve outcomes. So joining us this morning are two of the center's specialists. We have Dr. Gershwa Human, an interventional radiology expert, as well as Dr. Lisa Kirstner, a urology specialist. Both here to help us understand what men need to know and how early screening can save lives, literally. But before we get into the conversation, how are we both doing this morning?
Well, morning.
Yeah. Good. Thank you both for being here. And I absolutely love the fact that we can have this conversation on live TV, one that should be echoed with many men as we go forward. So hopefully this is the catalyst for exactly that. So Dr. Gusta, maybe we can talk about it. Exactly what is prostate health? Men hear about it, they shy away from it, they often only speak about it when it's a problem. But what exactly is going on in this department, and what does the prostate actually do?
Well, the prostate is a gland which is essential for fertility. So it makes about 30% of your ejaculate volume. It puts some things into the semen which actually help the little sperm cells to survive. It protects them. And it also secretes an enzyme which actually thins out the semen so that the little guys can swim through it.
Ah, okay. This makes sense. So that's quite an important function, right?
Pretty much,
and,
yes.
Dr. Human, obviously we're talking about radiology, interventional radiology. How have you seen in your experience men experiencing this for the first time, men going through this condition for the first time? When they hear about it, is it a matter of like shock, like I had no idea, was this even me? Or is it a matter of, okay, I'm aware of this, what are the steps? How do we go through this process? What do you experience on your side?
Well, in my experience, patients often, I think they feel relieved knowing what was the problem, first of all, with the symptoms they've experienced, like the urinary symptoms, frequently waking up at night, like the urine that doesn't come out very nicely. And then with regards to them actually getting the treatment at that point in time, they just want some form of treatment just to help relieve the issue. Like I think they've lived for such a long time with a problem. They just want to please help. Yeah.
And I like where you're going with this, because essentially, like what I'm sure you would imagine as well on your side, Doc, is that men are often just thinking that these are things associated with age. Or, I'm getting old, these are normal problems, these aches, these pains, these sensations, so to speak, or something associated with age. But is this an age-related sort of issue? Because this was a sort of understanding of the past, but often I'm experiencing and noticing that a lot of younger men are going through this process right now, or dealing with prostate cancer or issues. What's happening on your side, more in terms of the facts?
Yeah, I think people really do sign off a lot of things to age.
Yeah.
When I was younger, if a guy was 40 or 50, they were really, really old. But 40, 50 is middle age now.
It's the new crescendo.
Yeah, so so when you start getting those symptoms, it is because you are aging, but it's not always normal. And I think one has to remember that when it comes to prostate cancer, you may have no symptoms at all. So I think when you're looking at prostate symptoms, it is important to go and get those checked out, because the symptoms of prostate cancer and just the non-cancerous enlargement of the prostate, which gives you those symptoms, are actually quite similar and they overlap. So when you start getting those symptoms, especially if they're starting to bother you and impacting on your quality of life, you really should go and get it checked out.
So how do we check it out, Dr. Human? What is screening all about? Is it quite an invasive process? Is it something that we should easily be willing to do? Or talk me through the process here, especially for those that have no idea what's going on.
Yeah, well, I must say this, my field of expertise is more the management and the viewing of it. I think Dr. Kirstner has a lot more first-hand knowledge with that.
No, I'm really happy you asked about screening, because it's incredibly important. So when you ask about symptoms, as I said, prostate cancer doesn't have symptoms in the early phases. So when you're looking for your trigger to go and look, do I have something wrong with me, is when you're 50, you need to go. If you have no family history. If you're a man of African ancestry, we know those men are prone to higher risk and earlier cancers.
Oh, really?
They should go from the age of 45. And if you come from a family where there's a known genetic abnormality which we know is associated with prostate cancer, for instance, the BRCA gene, which is associated with breast cancer, those men should go and look for you to have a PSA at the age of 40. So I think it's really important that one does that. But the most important thing is in the South African guidelines, the finger exam is no longer included in that. So that's the thing which scares most men, that they go to the urologist, they're going to poke a finger up in my behind, but we don't do that anymore. It's not recommended in the guidelines, so it's literally just a blood test. So it's,
oh wow, okay, interesting. The game has changed quite rapidly, quite quickly, and I think that might have been one of the sort of barriers to entry for a lot of men that might have these old school philosophies and mindsets.
Definitely.
So that's quite comforting to know for a lot of guys that might have been apprehensive to go through the process.
Sure.
That's non-invasive, I would imagine, right? That's awesome.
It's a lot less invasive if you think about the screening that we do for breast cancer and for cervix cancer. That's just a blood test. It's really quite simple.
Incredible. Right, well, maybe Dr. Human, I can leave you with, or we can leave the people with this. We've got this new prostate cancer centre for South Africa, which aims to offer world-class care for personal touch. What exactly is going on here? How do people access this? And from your perspective exactly, how does this fill the gap for men's healthcare, which right now is probably at the forefront of our conversation?
Yes, yeah. So we're very proud of the Prostate Centre, it's something unique in South Africa. We are subspecialists, urologists and radiologists have teamed up to offer patients, a care with a focus on prostate problems. We have a passion for patients who have prostate problems, giving them the place to go to be helped and be sorted out. And it's a centre. They can visit our website, www.prostatecentre.co.za, and
nice.
Already there they can engage with us and start asking questions, so they don't have to be afraid to be there. And I must say, we're a centre, we are patient-centred. We can take patients, sit them down, talk about the risk factors, the contraindications of the management, and we can offer a whole spectrum of anything from non-invasive treatment options to very quite specialised surgical options.
Nice, all right. And not just treating us like another number, actually like a human being, which I think is so important in this volatile time. But to both of you, thank you. And please don't go anywhere, because we've got to carry on this conversation. Not only are we educating you, Mzansi, but we're also going to talk about how to prevent it, how we can maybe garner a healthier lifestyle to promote exactly that, but also how much further we can offer assistance for you. So don't go anywhere. This conversation continues in just a bit.
It's my feel-good breakfast show.
Welcome back, Mzansi. It's your Feel Good Breakfast Show, and what a feel-good conversation we're already having. For something that can be so intimidating and so overwhelming, our two specialists right now are really making us feel a lot better about this, because, yep, we are still back with him. It's Dr. Gershwa Human as well as Dr. Lisa Kostner. They are continuing our Movember conversation. Yes, not November, Movember. We're heading into that month, and it's a conversation on prostate health. And we're going to be focusing on practical steps, what men can do today, what treatments look like, and how a centre like this supports early detection and long-term well-being. And I think from our first conversation, one of the most important aspects that we highlighted was early detection, right? And how important is that exactly?
I think it's incredibly important to diagnose prostate cancer early, because if you diagnose it early, you have a huge kind of list of options. Whereas if you diagnose it later, those options become less and less, and unfortunately those options tend to have a larger impact on your quality of life. So it really is important to find the cancer early.
All right, but giving you lots of options, which...
To give you more options, and also options that have less impact on your quality of life than those that we would offer in patients that have more advanced disease.
Okay, so Dr. Human, let's say for men who have just received a screening result, maybe it's abnormal, maybe it's unusual, what happens next? What are the next steps in terms of, like, how should we feel about this? How should we approach this? What should we do? And what sort of advice would you have for someone that's actually going through this process and has heard this news for the first time?
Yeah. Well, from my experience, I would just say patients shouldn't think the worst.
Yeah.
It is quite a process from getting an abnormal screening result and to what actually happens in the end. And I think, again, Dr. Kestner has a lot more experience.
If I jump in there. So the test that we do for prostate cancer screening is the PSA. It's a prostate-specific antigen. So it's specific to the prostate, not to cancer. So there's a lot of things that can happen in the prostate that can increase that test.
That might not necessarily be cancer?
That might not necessarily be cancer. So it is important that if you get a test which is abnormal, that you go and see a urologist, because they're equipped to actually weed out what is cancer, what's not cancer, and do the tests that are required to make sure that you don't miss a cancer diagnosis. But it can be quite scary, but one does have to remember that that test is really not completely specific to cancer. It's specific to the prostate. So if anything's happening in the prostate, they can also help you with that. You know, if you have an infection or inflammation, or you're just not emptying your bladder properly, a urologist can help you with all of those problems. So it's really important, if you have an abnormal prostate-specific antigen test, or PSA, please go and see a urologist.
And either way, if it is abnormal, it's a good thing because it's allowing you to address a problem.
Exactly.
It's going to make your life better at the end of the day.
Exactly.
Right, well, everyone should do this thing, clearly. So when it comes to, let's say, lifestyle, how much of a role does that play in the greater scheme of things? I mean, is that contributing positively or negatively to this sort of area?
Yeah, well, there's not good evidence that if you kind of live a good life and eat well,
direct correlations,
that it's going to reduce your risk for prostate cancer. There is, in fact, evidence that if you have more than 21 ejaculations a month, that significantly reduces your risk of prostate cancer.
I don't know if you should have told me on that. Okay.
However, I'd recommend that you live a healthy life, you exercise, you maintain a healthy weight, you control your blood pressure, because that will reduce your risk for other illnesses. It will also take care of your erectile health as well. If you live a healthy life, anything that takes care of your heart health takes care of your erectile health as well. And if you die of a heart attack at 40, you really don't have to worry about prostate cancer. So I really recommend people should take care of themselves.
I love that. I was just thinking I should just message my wife now and just remind her about that great statistic. Thank you for that, Doc. Let's talk more seriously, though, because obviously it's a serious topic nonetheless, and especially if you are dealing with something like treatment. What does that actually mean, though? What is treatment? What does it result in us actually doing? What do we have to go through? Is it quite an evasive process as well, or is it quite manageable from your side? What do you experience? Or maybe from both of your sides, yeah.
I think it depends on when you're dealing with the prostate, if you're dealing with cancer or you're dealing with non-cancerous enlargement of the prostate, which is symptomatic. So both of those have quite a long list of treatments options, so it's difficult to unpack that in a short conversation. But when it comes to prostate cancer, I think one of the things which has improved markedly in the last decade, I'd say, is actually the multiparametric MRI, which allows us to pinpoint those patients that really need treatment and those patients who can maybe defer treatment, because we don't treat all prostate cancer patients immediately. So we can delay treatment to limit the side effects of the things that happen to patients after we treat them for a number of years until the cancer actually starts becoming a little bit more active. So I think that has changed in the last few years.
All right. So that's practical assistance. But what about emotional support? Because again, this is something that I think for men especially, not often are we conversing, not often are we being honest about our emotions and our feelings, and especially dealing with something that could be as overwhelming as this. What sort of practical advice is there, or assistance is there out there when it comes to that sort of sphere?
You know, I think one of the most terrible things about all prostate problems is that it's really quite a emasculating problem. You know, if you can't get erections anymore because you've had treatment for prostate cancer, or you're not continent of urine anymore because you've got a prostate issue, it really is it's quite horrible to deal with. And I think what's important for people around those patients is to remind them that irrespective of those things that have happened to them because of the illnesses that they've had or the treatment they've had, they're still a man. They're still the same person, and you should remind them that they still fulfill the same role and the same position within their family and in the community. It's also important that when you offer help to somebody, don't say, ask me if you need help. Men won't ask.
Yeah, that's
You have to offer concrete help. Can I make an appointment for you? Can I go with you to your appointment? That's the way that you get them to accept help. And something else that you need to do is you really need to find out more about the condition, because if somebody gets a bad diagnosis, they don't really have the energy and often the will to engage with all of the information around it. So you can be their support person, you can find out everything possible about that illness, and you'd have that information, so you can really help them, because you know what to expect as their treatment or their condition progresses.
Oh, well, thank you both of you. I think maybe Dr. Human, you can leave us again with the great information and the resources that are available in terms of getting the assistance and getting the help. You mentioned it earlier, there's a website that we can go to, but for anything related to prostate cancer or any assistance, plug the people, man. Let's hear it while we send this one home.
Oh, well, yeah, just again, visit our website, www.prostatecentersa.co.za. It's also a place where you can engage with us, ask questions, get involved, you know, with the treatment options and hearing more about where to go, what to do, and don't be afraid. You know, like that's how you get in touch with us.
I think from both of you, you've given me this moment of, okay, it's not that bad. We can all relax. There's so many incredible options. There's amazing people and opportunities to deal with something so important. So Mzansi, I hope you're enjoying this conversation. We're going to keep the health going right now and allow you to continue to breathe and take back your power.